Hi everyone. So I'm doing my presentation over procedural pain in the ICU patient. And I chose to find an article over a study examining arterial line insertion. I know we're learning about arterial line insertion right now in class, and for our other tests we learned about pain in the ICU patient and how important that is. So I wanted to do some research on that subject. So this study is showing how there's a big problem healthcare professionals face when they're taking care of their ICU patient, and that's managing their pain. This is a big challenge because many patients in the ICU are intubated, sedated, or have an altered level of consciousness, which results in an inability to self-report their pain. But as we know, just because they aren't able to report their pain, that doesn't mean their pain doesn't exist. And it definitely doesn't mean it's not having an effect on them. So arterial line insertion is a common procedure in the ICU. Actually, as many as 60% of patients get one of these inserted. And many studies have found that this is one of the most painful procedures an ICU patient will go through. As you can see here, the three most painful are chest tube removal, wound drain removal, and the third, art line. So this study just is showing whether or not procedural pain was assessed before or after an insertion, and whether any pain prevention interventions or treatments were performed by the doctors or nurses. The significance of this study is, according to the Joint Commission, optimal pain management is a measure of optimal care in the hospital. So, as we know, our ICU patients are already under extreme stress due to their injuries, their diseases, and being in pain will only add to that stress. As we know, this stress on the body can have lasting effects physically and physiologically, and psychologically. When patients leave the ICU, one of their main complaints is actually the pain that they experience there. And at times, this memory of pain can even cause some patients PTSD. So even though we may not hear them crying out in pain at the time, we know that this is an important thing we need to be focusing on. And often this responsibility of assessing pain, anticipating pain, and determining the patient's level of pain and providing relief lies in the hands of nurses. And this should be taken very seriously. So let's go down to the summary. This study found that only 21% of the patients in the ICU that had a art line insertion received an opioid or sedative prior to the procedure, and only 76% received a local analgesic. Nurses were the ones that documented all of the pain assessments, but most of these were only done within 4 hours, so just the normal pain assessment nurses do every day. Only 4% were done directly related to pain management for the art line insertion procedure. 98% of the time, the providers documented that the patient tolerated the procedure well. However, in the routine pain assessments done later by the nurses, 27 patients reported pain and 10 were given opioids to get their pain levels down. Because many of the patients were under deep sedation, it's likely they were unable to show pain, even non-verbally. So this is just showing the patients that were able to report their pain. So based off this study, we can really see not enough's being done to combat pain in the critical care patient. The findings show that procedural pain management should be routine. However, doctors only ensured local analgesics were used in 76% of the patients to prevent pain. As nurses, we are the ones that are ensuring our patients' pain levels are under control. We need to make sure we're properly assessing our patients, especially when they can't speak for themselves. And even though this is hard when our patient's sedated or intubated, we do have tools at our disposal to make sure that this is done properly. We have the behavioral pain scale and the nonverbal pain scale, as well as others. So we just need to make sure in our practice that even though our patient's not crying out or, asking for pain meds because they can't, it doesn't mean that their pain's not real, and it doesn't mean it's not affecting them. So it really is our duty to help them. So we need to make sure we're educated on what the most painful things ICU patients are going to undergo are, like art line insertion, and that can help us really manage their pain. And then I wanted to show you what the needle looks like for art line insertion. So that is a pretty big needle, as you can see, and it's not going into a vein, it's going into an artery, as you know, which is even more painful than going into a vein. So if you just think about how you would feel if that was being put into you and you had no pain management, you just have to think about yourself or a loved one. If they were in that position, it really can help you see how important this is and why we should make sure we're taking it seriously.